With our story of our DRX conversion of our X-ray room, we realized that our portable machines, still very workable, but there was a retrofit that we could put on our portable machines. So we went down that path and we put the retrofit on a portable machine, and wow, is all I can tell you. The retrofit went in on one day. The machine is still being used as the regular portable machine, but now having the DRX detector has allowed the technologists to go bedside, do their images, see their images within seconds, and move on. Interesting enough, once we started using the retrofit, we had a little competition in the hospital, which surgeon wanted the machine. The operating room surgeon made his case that the patients are under anesthesia, we should see our images quicker than with the old machine. And now it was still the same machine, but they thought this was a new machine because of the retrofit. And then the trauma surgeon pleads his case that I've got a severe trauma patient in the trauma room that we need to act on very quickly. I need to see my images fast, so that's my machine. So it left me in an interesting dilemma that I had to go buy a second machine real quick because I had to take care of both parties. So it's been a great story. It's worked very well, no downtime. Technologists love it. We have reduced our radiation exposure to our patients from converting from our CR device to our DRX device, and we've reduced our exposure factors almost 50%. Image quality has been wonderful, and the technologists want more. In the operating room, in our CR world, the technologists would go in and we would do an image. Then they would have to leave and go about 500 yards down to the CR reader, process the image, then send it to PACS, and then the surgeon would have to go to the screen and look up the image on PACS. So that time frame, without us really putting a time clock on it, took about 10 minutes. Now, with the DRX retrofit, we go into the operating room, we make our exposure. He's looking at the exposure on the monitor that's on the portable machine, and he's happy, and he's continuing his surgery. So that 10-minute was reduced to less than 30 seconds, which is obviously helps for patient care, reduces anesthesia time, reduces the operating time, and reduces any chance for infection or surgical complications. Because of the speed, it also allows the surgeon to be able to get a second film if he needed to pretty quickly, where he or she may hold off because of the time frame. So it does allow them to do that. And most of the time, after they close, they'll do their post-op films right in the OR instead of doing it in the recovery room later. So it's saving discomfort for the patient. So.